Hello everyone, my name is Jason Morgan, and today I will be presenting on behavior change and exercise, specifically how health-related behaviors both have a positive and a negative impact on our personal health. Our objectives for today are to define health-related behavior, review and discuss specific behavioral models that are used to measure and predict behavior change as it applies to daily physical activity and exercise. We will discuss the main reasons how behavior choices can impact our perception and attitude towards daily physical activity and exercise. We will also discuss current solutions being used to increase and sustain daily physical activity and exercise amongst the population. So what is health-related behavior? The Encyclopedia of Public Health defines health-related behavior as being behavior that refers to the actions of groups, individuals, and organizations, as well as the determinants and the consequences of these actions. The author and one of the leading researchers in the field of health behavior research, David Gochman, defines health behavior as those personal attributes such as belief, expectations, motives, values, perceptions, and other cognitive elements. He also included in the definition specific actions of an individual and the health of individuals. This was a different perspective when compared to the broad definition because Gochman believed that the individual behavior affects the outcome of a specific group, and then the group affects the outcome of the community. When you're looking at the broad definition, they're talking about the group affecting the community only. Gochman believed that the individual behavior ultimately determined many social environments that collectively affect the population. In 1966, Castle and Cobb defined three categories of health behavior that is still being used today within the public health sector. These three categories are preventive health behavior, illness behavior, and sick role behavior. When we look at preventive health behavior, we're looking at actions that are taken by individuals who already view themselves as healthy and make behavioral decisions for the purpose of prevention of illness. When we look at illness behavior, we're looking at actions taken by individuals who view themselves to be ill and make behavioral decisions for the purpose of understanding their current ill health status and ways to remedy the current ill health status. So they try to learn from the state that they're in order to improve their health. The sick role behavior looks at actions taken by individuals who are sick and may need treatment from medical providers. They may have a specific medical diagnosis. And they have to try to seek out some kind of physical activity or exercise that helps to improve their condition overall.
Change? Shit. I guess change is good for any of us. Whatever it takes.
So now we're going to take a look at theoretical behavior models that are most frequently used to measure and interpret behavior in relation to physical activity and exercise behavior. A lot of these models are used. This is, where we get our information as far as for specific health-related behaviors that the population may be currently involved in as far as for a state. Then we can use that information to develop more accurate programs or support systems that can help the general population increase their physical activity and exercise. James Prochowski's trans theoretical model and stages of change, um, this is one of my favorite models. I really like this model. It's used in various studies to understand behavior changes related to exercise, adherence. There's been other studies to understand behavior change in relation to HIV prevention, also in contraception usage and smoking cessation. We'll take a look at Albert Bandura's social cognitive theory. In this particular theory, Albert Bandura looks at mediating processes that can occur between the stimulus and a response. Um, More or less, what is going to create a specific behavior. Um, he also was concerned with behavior is learned from environment through the process of observational learning. If we can remember the Bobo study, that was one of the studies that was used with the social cognitive theory in mind. Also, Bandura, he believed that humans, think about their relationship between behavior and consequences. How a specific behavior may have a specific consequence, or vice versa. And in order to determine what type of behavior they wish uh, to take on and utilize in their life. Um, Also, the health belief model, which was originally created to explain why the public didn't take advantage of health preventive services, and also um, just more of about the threat of a health problem or recommended behavior for managing health problems, comes from this particular model. And also, community organizations are able to take in information from the general public in order to conduct health assessments to sort of give a basis for the general public to know where they are, where their health level is, their health status, and support it with uh, documentation or other forms of support to help them increase their overall health status in a direction of being healthier and having more exercise and physical activity. We take a closer look at Prochaska's chance theoretical model and stages of change. Health behavior change requires progression through 6 stages of change. Each category represents the current behavior, mindsets, or lifestyle of the population in regards to making healthy or unhealthy decisions about maintaining a healthy level of physical activity and exercise, or behaviors that create a healthy lifestyle. So when we look at pre-contemplation, we're talking, and what we're referring to is the group where people aren't even considering their health status. There's no thought about it. When we move into contemplation, then a group of people are in a state where they're actually considering making changes about their health. And when we look at preparation, we see a group of people who are taking the necessary means in order to get ready to take action and make uh, sort of like some type of structure to follow of short-term and long-term goals. Um, Action, of course, is when they put this preparation that they've been working on into action and literally get out there and start to increase physical activity and devise an exercise regimen. Maintenance would be that the exercise regimen and physical activity levels have been maintained for at least 6 months, and termination would be longer than the 6 month period where they have there's signs where old behaviors have been terminated. So with the trans theoretical model, Um, it's normally used for research to measure health-related behavior changes across the population. Um, the information that they gather from this research has produced a general rule of thumb ratio amongst the more sedentary behavior styles. So 40% of the population is in a pre-contemplation stage, meaning that 40% aren't even thinking about exercise. 40% of the population is in a contemplation stage, so the other 40% is actually considering becoming healthier. And then you have 20% of the population is planning to move into the action stage. So they're preparing for making subtle or even larger adjustments to their lifestyle in order to improve their overall health. This information is collected, and it allows the exercise science professional to design programs that support and promote daily physical activity and exercise to either individuals or community-based groups. So we can implement this knowledge that we receive from the research, and then we can design specialized programs from it to help to change these numbers and increase daily physical activity and exercise related behavior across the population. So when we look at the main reasons why the national average of regular physical activity and exercise is nearing almost 50%, between 40 and 50% of Americans being sedentary, and 50% of Americans will discontinue an exercise program within about 6 months of starting. So the number one reason for this, according to research, has been time. We all can relate to that. Time is very difficult to manage these days. This is a very demanding world we live in, and it's really difficult to allocate more time in our lives. So this becomes a really big problem for being able to stick to a regular exercise regimen. Also, attitude. Attitude is pretty high on the list, and that could be attitude towards perceived risks or yourself, just the way that you feel about yourself, or the way that you feel about what could possibly happen to your health in the long run if you don't do anything about it. And one of the bigger, more modern agitators, so to speak, that has a dramatic impact on the national average is self-efficacy. And this is just having the confidence in your ability to adhere to exercise, regardless of possible reasons not to exercise. So if there's a bunch of different types of blocks or obstacles in your way, you're still able to stick to a program that's designed for you to become healthy and not let anything stop you from achieving that. Some of the other things, social determinants such as socioeconomic status, level of care available within the neighborhood, policy by lawmakers, just, it depends. There could be a number of things that could affect whether or not a person gets the recommended regular physical activity daily or exercise. A lot of times in neighborhoods that are low income or have a very low socioeconomical status, they don't really have the resources available to educate the public in that area about sometimes just even the general health concerns, and that we should all know about. So a lot of times people miss out. They're just not exposed to it in their environment, and this could have a great impact on whether or not they get physical activity or exercise regularly. Some of the other things also have been temptations, which we all know are very difficult to overcome sometimes, but it could also be a good thing. You know, you could be set up your lifestyle in a more positive way that creates temptations to want to exercise more regularly. So it doesn't necessarily have to be negative, but this is definitely a negative aspect of why the national average is pretty low. So as far as for people exercising regularly. Decisional balance between pros and cons is more about weighing out, the good and the bad about exercise and in relation to your health status level, whether it's current or where you want to be. So, if you feel like you're unhealthy and you want to be healthier, then, you have to weigh out what it's going to take for you to get there, as opposed to not doing anything at all and where you will be eventually, where it could be a state of ill health. So now we'll take a look at some of the current strategies being implemented to encourage adherence to exercise and physical activity. One of the things, printed materials of benefits of regular exercise has obviously been very popular over the several years now. But this allows a family member to bring home information to the rest of the family, therefore sharing it with more than just themselves and educating sort of like a support group for them. And everybody gets to discuss it and talk about it. Also, group support sessions um, have become very popular as well. And this could be community based volunteer group sessions. This could be paid for group sessions. This could also be more from a psychological standpoint where you have a psychologist leading one of these group sessions, helping people to more or less have each other to bounce ideas off, what works, what doesn't work for them, how they can sustain regular physical activity and regular exercise. Also, we have websites with health information and video exercise classes, which is very popular. Most of the time, it's free. You can get online. You can pretty much do whatever kind of exercise that you want. There's hundreds of thousands, I'm sure, available. Also, goal setting, which is very, very important. I mean, you must have goals in order to achieve uh, whatever it is that you're trying to achieve. So to get there, you have to have small goals and build up to larger goals. So that way you can establish some type of momentum in the direction of improving your health and well-being. Also, recommendations by physicians have become more popular. We see this more often than not. I think that the overall idea of physicians recommending uh, to patients to by encouraging them to participate in daily physical activity, or to devise or seek help to get someone, a professional, perhaps someone in exercise science, to help them develop an exercise protocol that they could follow. Um, Physicians are becoming more open to this idea, and this is a really good thing for everyone. Telephone counseling for those who are exercising at home, unsupervised, but feel they need a little bit more support. They can also turn to telephone counseling and speak to health professionals who are available to help motivate them and keep them on track. These theories focus on specific social cognitive variables such as attitude, self-efficacy, and social support interventions. Some of the current strategies being implemented to encourage exercise adherence and physical activity are Exercise is Medicine Initiative, which was launched in 2007, and it encourages the primary care physician and other healthcare providers to include exercise when designing treatment plans for their patients. What a great idea. Um, this is a really good program. It keeps primary care physicians in touch with their patients, specific health needs, and helps them design plans that are more fitting for their lifestyle. Healthy People 2020 focuses on physical inactivity and obesity and encourages healthcare providers to form a discussion about recommended physical activity levels with their patients. Another great organization that is constantly um, getting the research results, providing it to the healthcare providers so they can turn around and discuss this information directly with their patients. Um, and another program that's trying to evolve is a push in the direction of physician referral system to community-based healthcare professionals such as exercise science and physiology professionals who are educated and qualified to implement health behavior change techniques and principles. Um, Muth et al. Did some research and provided an article stating pretty much defining the need for this particular referral system. Um, Muth said that physician referrals to community-based fitness professionals who can help patients translate clinician-advised exercise recommendations into individualized and effective exercise programs. So it's more of a team-based care um, sort of program that where the primary care physician would um, refer the patient to this group, and then this group would manage their physical activity levels, design plans for them, focus on any of the factors that are contributing to them not exercising or getting physical activity, design these programs around any kind of medical history that they may have, and manage their health over certain amounts of time in order to keep them or get them to a state of better health. So that way, it's sort of giving them the support all the way through and showing them the tools that they need in order to sustain this behavior once the program is over. So this is a bit of a recap to conclude the presentation on behavior change and exercise. We discussed the meaning of health-related behavior change. We also discussed theoretical models used to measure and predict behavior. We discussed the main reasons why exercise adherence is difficult to initiate and maintain, and we discussed current strategies and proposed ideas to increase exercise and physical activity across the population. This is very important. Specifically the strategies. I mean, we are all healthcare professionals or students in moving in that direction. And it's real important to understand, I think, for all of us, our responsibility in helping people um, develop specific strategies to become successful in maintaining a healthy state of living. Um, so the first thing that we really need to focus on when we're dealing with these patients is to help them devise a plan that works for their lifestyle. Something that can fit into their lifestyle where even if it's very small changes that can occur, um, any change is better than nothing. So I think having a plan, setting up goals is probably the most important aspect of any of the strategies as far as for being able to move forward from that point in the direction of improving health and well-being within an individual and within a community.
for you. All right.